it's important to understand how a normal pelvis moves. And I really believe this is because it's a right-handed world, and when we lean to the right, like most of us do to open a door or to use tools, that the right side goes forward. And when it goes forward, because of the shape of the joint, the right hip will move anterior and superior, anterior and superior. This will tend to move anterior and superior. And when that person lies on their stomach, this will look like it's the high innominate bone. And on the left side, it will move posterior and inferior. It will move posterior and inferior. And that's very typical in terms of how a person's pelvis will generally present themselves when they come to your clinic or office. Sometimes it's different, but you're going to find this to be a very, very common position. So of course, that means you're going to want to use your forces more to move the anterior side more posterior, and the posterior side commonly more anteriorly. So now we're going to talk about some more exotic dysfunctions of the pelvis. And these are problems that happen with the innominate or hip bones. Remember we talked about how it's very common for the right hip to move anterior and superior, and the left hip to move posterior and inferior. A way of assessing that is to take your thumbs and put them on the crest of the innominate or hip bones. And look at that. You can see how her right innominate, like most people's innominate, is forward and up. So how do we correct it? That's called an upslip. So what that means is her pelvis on this side, her innominate, has moved forward and up, so it moves forward and up. So if this innominate or hip bone has moved anterior and superior, we need to push it posterior and inferior. So I can move it inferior by putting my pisiform bone on the crest of the hip. But don't forget that the pelvis moves like this. So I can assist myself by putting my other hand on the ischial tuberosity, and I'm going to push on it to move the innominate bone posteriorly, while my right hand has it move inferiorly. And all I have to do is hold it very gently. I push on both. I just wait about 10 or 12 seconds and it will move. There it goes. I just feel my hands soften. There's nothing dramatic, but you can feel your hands soften as it moves. I don't know, Julia, can you feel it softening and moving? Mm-hmm. Yeah, okay, good. And now I'm moving this innominate bone posterior and inferior. And now I'm going to go to the other side because this is anterior and superior. And I will use more force on the side that is tighter. So I want this to go anterior and superior. So I will put my pisiform on the ischial tuberosity and move it from inferior to superior while I push on the posterior superior iliac spine of the innominate bone and push it anterior. And that's moving actually very easily. It feels very soft. So that to me tells me it's a compensation. So I'm going to go back and check this other side one more time, because I think that's the major problem, and just make sure that's nice and loose. And when I push on this right innominate bone, I can feel it softening again. So now you can see that when I check the leveling, these sides are much more even. So now we're going to talk about inflare, outflare. Generally, the innominate bone is outflared on the left and inflared on the right side. However, very often people will fall on their hip and that hip will become inflared. So if this innominate bone is inflared or moved medially, I need to move it laterally. So I'm going to grab the hip bone in front at the ASIS. I'm going to also grab the crest of the innominate bone and put my thumb also on near the PSIS. What I'm going to ask you to do, Julie, is to gently lift your knee up and then down. So up this way and down. Perfect. And now I want you to lift that knee up and just hold that, perfect. And now she's helping me move it into an out flare position. And there it goes. And then relax, and I push it back medially a little bit, and then lift it up again, and I move it out laterally. I want to make sure that this hip bone can move internally and externally, or medially and laterally. Now it feels much better. Okay, and now lie on the other side. So generally the right side is more inflared, and this side does feel more inflared, so let's just out flare it a little bit because it's stuck a little bit in and a little bit out, just stiff in both directions. So if I want to move the hip bone medially or toward the midline, I want you just to press your knees together a little bit. That's good. Now I'm pushing it medially and then relax. And now I want you to do what we did before on the other side, is lift the knee up. And you can keep your ankles together, just lift it up that way, perfect. And then down, and then lift it up and hold it, good. See, bones can get stuck in the neutral position. We want a little bit of movement, and then down, and then relax. And let me test, I'm moving it in, just relax and out. I want you to push your knees together a little bit. That's good. And then relax. And now when I repalpate, it moves medially and laterally very easily. So we've now corrected the upslip and the in-flare, out-flare.